Okay, good afternoon, and thank you for joining the daily briefing on the City of Philadelphia's response to COVID-19. Today, our speakers are joining the briefing virtually to adhere to social distancing guidelines. And we begin our briefing with opening remarks from Mayor Jim Kenney. Mayor, you have the floor.
Thanks, Mike. Good afternoon, everybody. Happy Monday. This morning, Philadelphia City Council launched its review of our proposed fiscal year 2021 budget and five-year plan. In light of the pandemic and the resulting economic downturn, the decisions that we as city leaders make are the most difficult and most important of our careers as public servants. I want to thank City Council President Darrell Clark and all the members and their staff for overcoming tremendous logistical hurdles to hold these abbreviated virtual hearings. And I appreciate the seriousness and open-mindedness with which they are approaching this task. As I said on May 1st, when I delivered the budget, we must transform our priorities to best meet the needs of Philadelphians, particularly our most vulnerable residents, under this new reality. We hope that by focusing on core services and maintaining fiscal stability, we will be able to rebound as quickly as possible. I look forward to further hearings and discussions with council members. As construction projects start to resume across the city, we also have begun to restart important infrastructure work carried out by our operating departments. Starting this week, crews will begin milling streets in the Northeast and Northwest as part of our annual street paving operations. Although the Streets Department's 2020 paving program was delayed by COVID-19, this important work is now underway. We have implemented new CDC and social distancing guidelines for our city crews and contractors to make sure this work is completed safely for everyone. We want to remind residents that this resurfacing work includes street closures and parking restrictions. Weather may also alter the work schedule. Residents can stay updated on the progress of street paving using the online Pave PHL tool. This online application shows which streets are scheduled to be paved this summer and will continue to be updated as the season progresses. To learn more, residents can visit PAVE, that's P-A-V-E, PHL.phila.gov. That's PAVE, PHL.phila.gov. And while we're on the topic of paving, I want to share our plans to improve a major corridor when it is repaved in the year 2021. Starting today, we are seeking resident feedback on redesign plans for Washington Avenue from 4th Street to Gray's Ferry Avenue. Because of COVID-19 social distancing guidelines, in-person open houses and community meetings are not currently permitted. Therefore, we are communicating and seeking resident feedback on Washington Avenue through multiple channels, including an online survey, phone calls, text messages, email, and direct mail. Our goal is to improve Washington Avenue for everyone. That includes creating a smoother street by repaving the entire road in the year 2021 and creating safer and shorter pedestrian crossings. We also want to improve parking, loading, and add protection between bicycles and moving traffic. Please, plans also call for enhancements to Sector 64 bus stops along Washington Avenue. Our engineers have also examined ways to reduce speeding and aggressive driving along this corridor. All proposed options offer a safer, more functional roadway than it is today. And we encourage residents who live nearby or travel on Washington Avenue to go online to watch a series of short videos to learn more about the project. Residents can complete an online survey to share their feedback starting now through July 1st. All materials about the project, including the videos and survey, are available in English, Spanish, Vietnamese, and simplified Chinese. To learn more, visit bit.ly, bity.com/improve Washington. That's bity.com/improve Washington. I want to thank our Office of Transportation Infrastructure and Sustainability and the Streets Department for their work on these plans. This weekend, as you know, is Memorial Day weekend. While many of us won't be celebrating in the ways we normally would, we invite you to tune in on Thursday night to PHL Love, a variety show benefiting PHL COVID-19 Fund. Our hometown favorites like Patti LaBelle, Daryl Hall, Questlove, and many more will put on a show to help continue to raise critical funds. These donations are helping to keep our neighbors fed, healthy, and in their homes during these uncertain times. Our show is made possible by the generosity of the Middleton family, all of whom have stepped up and supported our fund early on. I look forward to watching PHL Love with all of you on Thursday at 7 o'clock. It will be carried on many of our local TV stations and streamed online. Go to phlcovid19fund.org to learn more. That's phlcovid19fund.org. And now I'll turn it over to Dr. Farley for his daily update.
Thank you, Mayor. Just a quick update today. We're continuing to make good progress against the coronavirus epidemic here in Philadelphia. Let me update you with the numbers. Now, we didn't do a press release yesterday, so these numbers are giving you are for 2 days since Saturday. So that's represent 2 days worth of data. In that time, we've had 347 new cases of coronavirus infection confirmed in Philadelphia residents, bringing us to a total of 19,953 since the beginning of the epidemic. We are continuing to see progress in our clusters in congregate settings. The jail clusters had 1 new case in an inmate in the last 2 days, and there are currently 4 inmates with active infection. From the hospitals, we have no report from them today, but as of yesterday, Sunday the 17th, there were 652 coronavirus inpatients in Philadelphia hospitals, 1,234 in the region. That's down about a third from the peak of where we were in late April. So clearly a big decline, and then more capacity available in the hospitals across the region. In the last 2 days, we've had 9 deaths confirmed from the coronavirus infection, bringing us to a total of 1,040 since the beginning of the epidemic. Of those, 563 or 54% were in nursing home residents. Just a little bit on testing. We've expanded the number of test sites, and I've been talking about that each day, this increased number of test sites. With that, there clearly is availability of testing across the city now. In the past, we've limited access to testing because there are only so many people we could test. But now we're in a different posture, and so we want to encourage people to be tested. So anyone with a new onset of respiratory symptoms, such as a cough, shortness of breath, or even a sore throat, or a fever, at any age, we encourage you to get tested. So to do that, you go to our new testing site map, www.phila.gov/testing. See the sites across the city. Click on those sites. You see a phone number. Call the phone number, make an appointment, and get tested free of charge. Many different options. We really want to uncover the cases we might otherwise be missing at this point in the epidemic. For everyone, whether you have symptoms or not, remember the basic principles. Wear a mask. You don't want to acquire the infection. You don't want to spread the infection. Keep your distance and wash your hands. Now, as the mayor said just a minute ago, Memorial Day weekend is this weekend. And so it's not too early for us to talk about what not to do this weekend. Don't go to the beach. We are not recommending people go to the beach this weekend. It is true that being outdoors is probably less risk than being close to people indoors. But if you go into crowds anywhere, there's risk. We understand the draw. It's very tempting. You may have gone to the beach every Memorial Day weekend for years, but this is not the time to do that. Let's wait until the case counts are lower for it to be safer. For more information about the epidemic overall in Philadelphia, www.phila.gov/COVID or 1-800-722-7112. Thanks.
Thank you, Dr. Farley. And now we will go to Armando for the Spanish language translation of the mayor's and Dr. Farley's remarks.
Mensaje del alcalde Jim Kenney para el lunes 18 de mayo del 2020. Buenas tardes a todos. Esta mañana el Ayuntamiento de Filadelfia comenzó su revisión del presupuesto que hemos propuesto para el año fiscal 2021 y nuestro plan quinquenal para los próximos 5 años. Debido a la pandemia y la recesión económica resultante, las decisiones que tomamos como líderes de la ciudad y como servidores públicos se encuentran entre las más difíciles y las más importantes para todos. Quiero agradecerles al presidente del Consejo Municipal, Darrell Clark, y a todos los miembros de su personal por superar los enormes obstáculos logísticos para poder celebrar estas audiencias virtuales. Aprecio la seriedad y la mente abierta con la que están asumiendo esta tarea. Y como dije el 1 de mayo, cuando entregué el presupuesto, tuvimos que transformar nuestras prioridades para satisfacer mejor las necesidades de los habitantes de Filadelfia, particularmente las de nuestros residentes más vulnerables, en vista de esta nueva realidad. Esperamos que al centrarnos en los servicios básicos y en mantener la estabilidad fiscal, podamos recuperarnos lo más rápido posible. Y espero estar presente en nuevas audiencias y en debates con los concejales del municipio. En otro tema, y a medida que los proyectos de construcción comienzan a reanudarse en toda la ciudad, también nuestros departamentos operativos han comenzado a reanudar los trabajos de infraestructura que se encontraban pendientes. A partir de esta semana, los equipos comenzarán a trabajar en las calles en el noreste y el noroeste como parte de nuestras operaciones anuales de pavimentación de las calles. Aunque el programa de pavimentación para el año 2020 del Departamento de Calles se retrasó por el COVID-19, este trabajo tan importante ahora ya está en marcha. Hemos implementado nuevas directrices de distanciamiento social para nuestros equipos y para los contratistas de la ciudad, para poder asegurarnos que este trabajo se complete de manera segura para todos. Queremos recordarles a los residentes que este trabajo de repavimentación incluye el cierre de calles y restricciones para el estacionamiento. El clima también pudiera alterar el horario de trabajo. Manténgase al tanto. Los residentes pueden mantenerse informados sobre el progreso de la pavimentación de las calles usando la herramienta en línea PAVEPHL. Esta aplicación en línea muestra qué calles se han programado para ser pavimentadas este verano y los datos se irán actualizando a medida que avance la temporada. Respecto al tema de la pavimentación, quiero compartir nuestros planes para mejorar un corredor importante y su repavimentación en el año 2021. A partir de hoy, estamos buscando las opiniones de los residentes sobre los planes de rediseño para la avenida Washington desde la calle 4 hasta la avenida Grace Ferry. Debido a las pautas de distanciamiento social del COVID-19, actualmente no se permiten las reuniones presenciales y, por ende, las reuniones comunitarias. Por lo tanto, nos estamos comunicando y buscando opiniones de los residentes de la avenida Washington a través de múltiples canales, incluyendo encuestas en línea, llamadas telefónicas, mensajes de texto, correo electrónico y correo postal. Nuestro objetivo es mejorar la avenida Washington para todos. Esto incluye crear una calle más lisa, repavimentando la avenida en 2021 y creando cruces peatonales que sean más cortos y más seguros. También queremos mejorar el estacionamiento y las zonas de carga, además de agregar mayor protección entre las bicicletas y el tránsito vehicular. Los planes también requieren mejoras en las paradas del autobús de la Ruta 64 de SEPTA a lo largo de la avenida Washington. Nuestros ingenieros han examinado formas de reducir la velocidad y el manejo agresivo a lo largo de este corredor vial. Todas las opciones propuestas ofrecen una vía más segura y funcional de la que hay actualmente. Les alentamos a los residentes que viven cerca o que utilizan la avenida Washington a que se conecten en línea para ver una serie de videos cortos para obtener mayor información sobre este proyecto. Los residentes pueden completar una encuesta en línea para compartir sus opiniones desde ahora hasta el 1 de julio. Todos los materiales sobre este proyecto, incluidos los videos y la encuesta, están disponibles en inglés, español, vietnamita y el chino simplificado. Para obtener mayor información, visite bit.ly.com Improve Washington, que es decir, bity.com/Improve Washington. Quiero agradecerle a nuestra Oficina de Transporte, Infraestructura y Sostenibilidad y al Departamento de las Calles por su trabajo con estos planes. Finalmente, como saben, este fin de semana es el día de remembranza o Memorial Day. Si bien muchos de nosotros no lo celebraremos en la forma en que lo haríamos normalmente, el jueves por la noche los invitamos a sintonizar PH Love, un programa de variedades que tiene como objetivo beneficiar al fondo PHL COVID-19. Hay artistas muy queridos en nuestra ciudad como Patti LaBelle, Daryl Hall, Questlove y muchos más, quienes amenizarán un espectáculo para ayudar a continuar recaudando fondos necesarios para combatir esta pandemia. Estas donaciones están ayudando a mantener a nuestros vecinos alimentados, saludables y en sus hogares durante estos tiempos inciertos. Y este espectáculo es posible gracias a la generosidad de la familia Middleton, quienes vienen apoyando nuestro fondo desde el principio. Espero poder sintonizar PH Love con todos ustedes este jueves a las 7 de la noche. Se transmitirá en muchas de nuestras estaciones de televisión locales y también en línea, y no se lo pueden perder. Para más información visite phlcovid19fund.org. Y esta es la actualización en materia de salud para el día lunes 18 de mayo del 2020. Desde ayer se han confirmado 347 nuevos casos del coronavirus en Filadelfia y actualmente tenemos un total de 19.953 casos en toda la ciudad. Se ve una clara tendencia en la disminución de los casos y estamos viendo un claro avance. Los datos de esta actualización comienzan desde el día sábado e incluyen 2 días de datos. Reportamos mejoras también en la evolución de los casos en los entornos grupales. Reportamos un nuevo caso del COVID-19 en las cárceles y actualmente tenemos solamente 4 casos confirmados. Hoy, tristemente, reportamos 9 muertes por la COVID-19 en la ciudad. Hay un total de 1.040 personas que han muerto por la COVID-19. 563 o el 54% de estas muertes han sido en hogares de ancianos. Les recordamos que este virus no discrimina por raza o por género, y hay que tener en cuenta que aún no hemos recibido el informe del día de hoy. Hasta el día de ayer, domingo 17 de mayo, 652 personas han sido hospitalizadas en Filadelfia y 1.234 personas en la región sureste de Pensilvania. Estas cifras nos demuestran un claro descenso en las admisiones a hospitales por 10 días consecutivos. En el sitio web se pueden encontrar gráficos con el número de casos, muertes, casos en hogares de ancianos y las admisiones hospitalarias. La demanda de pruebas ha disminuido porque a medida que los casos disminuyen, la preocupación por realizarse la prueba es menor. En el pasado, teníamos acceso limitado a las pruebas debido a la poca disponibilidad de las mismas, pero ahora les alentamos a todas las personas de cualquier edad que tengan fiebre o problemas respiratorios a realizarse la prueba del COVID-19. Las pruebas están disponibles con cita previa. Usted puede ubicar el centro de pruebas más cercano a su hogar utilizando el mapa interactivo en fila.gov/testing. Recuerde usted usar una máscara al salir de su hogar, mantener la distancia social y lavarse las manos frecuentemente. Mi máscara te protege a ti, tu máscara me protege a mí. Y juntos podemos superar este gran reto. Gracias.
Thank you, Armando. And now we're going to move to our Q&A portion for members of the media. Please note that in addition to the mayor, Dr. Farley, and managing director Brian Abernathy, today we are joined by two other city officials, Police Commissioner Danielle Outlaw and the mayor's chief of staff, Jim Angler. Remember that we have limited time during the briefing, so only one representative from each media outlet is permitted to ask questions, and reporters are asked to limit their questions to 3 or fewer. We will do a second round of questions if time permits. For the reporters logged in today, please use the raise your hand feature found under the participants list. And when you are called on, we ask that you activate your video to ask the question if you are able. We will now unmute reporters one by one to ask their questions, starting today with Jeff Cole of Fox 29. Jeff, you're up.
Yeah, these are questions for Commissioner Outlaw.
Hi there.
Commissioner Outlaw, are you considering or will you take the police chief's job in Oakland, California?
No and no.
Have you been contacted by that department and asking you if you to seek the job?
No, not at all. The first time I heard about it was when Mr. Abernathy was asked in the presser last Friday.
Commissioner, do you believe that the 1.6 million citizens of Philadelphia deserve to see their police commissioner discussing the commissioner's policy toward crime on a fairly regular basis? And if you do, why haven't you done more of that?
Absolutely. I think that's a fair question. I think we all, so there's a couple of things. I think we need to catch up as far as technology goes. We need to utilize the platforms that are available to us virtually. Obviously, a lot of the engagement that began when I first got here, doing community meetings, hosting in-person meetings, all of that has had to cease. But I think absolutely citizens deserve to hear from me. They will be hearing from me soon as it relates to additional plans. But all of that has been taking place. It hasn't been publicized, but I've had the opportunity to meet with several community groups and key stakeholders in the interim. So I'm looking forward to not only allowing people to see me more, but figuring out the best way to do this in the using the technology that we have, also understanding that everybody doesn't have access to technology in the same way.
Commissioner, all you need to do is call a press conference and step in front of cameras and reporters, and they will see you. Why haven't you done more of that?
So, I think there is some, and I think, again, Jeff, these are fair questions, and I appreciate you asking them. I think, under the structure that we're working under, when the ICS system is enacted, when we're working under a pandemic, you see other people more than others, right? So you see the managing director, you see the mayor, and you see the health commissioner, because that's how it works. You would see me on a daily basis if we were talking about terrorist threats or a terrorist event or an active shooter incident. I have made myself available, as far as I know, whenever the requests have come forward, I've gone out of my way to make myself available. But again, I hear you, and that we can do more to be proactive about that. So I don't just you're saying.
Last question I have. Are you comfortable with this job, Commissioner? Do you think that you are doing a good job in fighting crime?
You're at 5 questions, so we'll go to a second round. Please hang on.
I think she's doing a good job, and I hired her.
We're going to go now to Chad Pradelli of 6ABC.
In here. There we go. Sorry, guys. This message is for the mayor. So South Jersey obviously has opened up curbside pickup for retail businesses. You know, some in our area are questioning if these restaurants and fast food establishments can do curbside pickup, why can't retail businesses do the same in our area?
That's not a question for me. That's a question for Dr. Farley. And as soon as he tells me we can do that, that's what we'll do.
I guess I'll direct that then to Dr. Farley.
You know, that's actually a question for the governor. Under the governor's orders, my understanding is that curbside pickup for retail is not allowed. And so we are, working closely with the governor. We're going to follow the governor's order.
So as a medical doctor, I mean, do you think there's a bigger, more increased risk for, say, retail pickup of retail goods versus, food, which people put in their mouth? And obviously it's a way you
not at the individual level, but if all retail stores opened up to provide curbside pickup, that would mean that there would be more staff in there that would provide that service, and more people would be going out to do that pickup. And so you would have more people coming in contact with more people. And so the question is this, are case counts low enough to where we feel comfortable making that change? And that's not a change that we're going to make without, being allowed to by the governor, without conversations with the governor.
Also, with regard to the retail businesses opening up in South Jersey, we spoke to a number of them. Many said that they continued, even during the last month or so, they were quietly doing some retail curbside pickup in their businesses. This is maybe for the mayor or the managing director. I mean, have you heard of reports of that happening in Philadelphia? And do you think the businesses are doing that against the
I'm sure most of the businesses are abiding by the law. Even in good times, we have businesses that don't follow the regulations of the law. So yeah, I assume that there are some. The issue, frankly, is this: if we have a major surge in the fall and winter, I want to hear all the same questions being asked as to why they opened up and why they relaxed in Georgia and Florida, because the economy will be worse off for it, and people will be sicker for it, and more people will die because of it. So we're doing what we think is responsible on behalf of health and science and our people who live in our city. South Jersey does what South Jersey does. It's going to affect us because people are going to go to the beach this weekend. They're going to congregate with people in too close proximity. Then they're going to drive back home to Philadelphia and perhaps give the virus to somebody in their family. So I think that we're being responsible. We see our case counts going down. We see our deaths going down, and we're going in the right direction. Why would we screw that up?
One more question. You already mentioned that you're discouraging people from going to the shore, like you mentioned. What about those curbside businesses, say in Cherry Hill, Haddonfield, those areas? What would your message there be?
I'm not responsible for them. I'm responsible for Philadelphia. And
I'm talking about Philadelphia residents going up.
What would I say to them? What would you suggest I say to them?
I'm asking you. I'm not the mayor.
They're following what their governor's allowing them to do. And we're what our governor's telling us.
Let me see if I can take a stab at that. I mean, look, we've known residents have gone to Delaware to pick up liquor. We know that people are going to Jersey for various reasons. We're asking people to be smart, to use common sense and make sure that they protect themselves, their families, their communities by wearing masks and keeping socially distanced. And the key to this crisis is don't be a jerk, and let's figure out how to get through this together as a community.
Thank you, guys.
Thank you, Chad. Next up is Natasha Brown of CBS 3.
Hi, this question is for the mayor or possibly Brian. Just in light of the budget hearings that are happening now and organizations really understanding the brunt of what they'll be dealing with, like the Philadelphia film industry, just today talking about how the budget cuts are going to ultimately impact them indefinitely and maybe the entire film industry in this area. Just your thoughts about that and what they're dealing with or what they will be dealing with.
This is a $650 million problem. Back in 2008 and 2009, it was a $108 million problem. It's a $650 million problem. And everyone's going to have to pull together to get us out of this. And I understand why each individual sector or segment of the economy or of the city has their own interest in mind and their own special interest. I appreciate that, and I sympathize with that. It's a $650 million problem we need to face, and we're facing it.
All right. Thank you very much. That's all I have.
Thank you, Natasha. Jack Tomzik of Metro, you're up next.
Yes, going back to the budget hearings, it was mentioned today that more than 400 people are going to be included in that first round of layoffs. Is that an accurate number?
Yes, that number is it is around 400. It's not exactly 400, but yes, around 400.
Around 400. And do you have any breakdown of that by department?
I do not at this point. We'll see if we can't get that back to you.
Okay. And then my third question was, this is either for the mayor or for Dr. Farley. Do you feel that, as the weeks go by, people who were maybe strictly following social distancing guidelines are relaxing their behavior?
There is some data on that we've seen. Some evidence from cell phone data that for the most part, people are still following our recommendations. They may be easing off a little bit, but for the most part, they're doing the right thing.
All right. Thank you.
Thank you, Jack. Now we go to Argenis Figueroa of Univision.
Good afternoon, Mayor and everyone. I will need the Armando translation, please.
Por supuesto, Argenis, aquí estamos.
Gracias. Armando, mi pregunta será directo para el alcalde. Y es que, bueno, en todo este tiempo hemos recogido alguna preocupación de la comunidad hispana, en este caso indocumentada. Y la pregunta sería si los fondos que solicitaron al Congreso la semana pasada fueran asignados. ¿Han pensado en algún programa que ayude directamente a las familias hispanas indocumentadas?
My question this time is for the mayor, and I'm wondering, throughout this time, we've seen about the concerns from the Hispanic community, more specifically the undocumented community. And my question has to deal with the funds that were requested from Congress last week. Were they given, and is there any plans to put them into practice in some sort of a program to help this immigrant undocumented community?
I mean, my understanding of the funds that were passed by the House is stalled in the Senate. So I'm not sure exactly what funds he's talking about.
Lo que entiendo yo es que los fondos que aprobó la Cámara Baja del Congreso han quedado trancados en el Senado. No sé exactamente a qué fondos te refieres.
Una carta que solicitaron más de 15 alcaldías la semana pasada. 15 alcaldías, perdón. Me refiero a esa carta directamente, que vendría siendo una solicitud de fondos adicionales para cubrir el déficit presupuestario.
I'm referring to a letter that was circulated last week, and it was sent on behalf of 15 mayoral officers, specifically requesting additional funding.
We're requesting additional funding for lots of various issues that we're facing: revenue loss, and recovery of some of the money we're spending on the COVID-19 issue. We are helping every community in the city. We're not asking for documentation. We're not asking for papers. And we love our immigrant community, documented or undocumented, and we're doing our best to get resources to everyone. Asking for specific programs from the federal government for undocumented immigrants is unlikely to get any response.
Nosotros estamos viendo muchos temas con respecto a los fondos, con respecto a la pérdida por los ingresos debido a esta pandemia y a los gastos que tenemos que recuperar por la inversión que hemos hecho para responder a ella. Nosotros tenemos que acercarnos a toda comunidad, sin importar si sean documentados o no, si tengan documentos al día o no. Nosotros amamos a nuestra comunidad inmigrante y vamos a poder poner recursos a disposición de todos, no solamente de ellos, pero pedir algo específico a favor de la comunidad inmigrante en Washington en estos momentos no creo que sea viable. Gracias.
Muchas gracias a ustedes. Es la única pregunta.
Thank you to everyone.
Thank you, Argenis. Michaela Winberg of Billy Penn, you're up.
Hi, everyone. A couple questions. The first one, I believe, for Dr. Farley. Can you clarify why the department's not releasing numbers on Sundays anymore?
We don't get as many test results on Sundays as we get on other days. And so the numbers really weren't terribly meaningful. All we had to say is, well, it's a low number today, but we've got fewer test results in. And to be honest, My staff spend hours every single day pulling in different data feeds in order to generate just those few numbers that I report every day. They've been working 7 days a week since February, and I thought they could use a break.
Got it. Thank you. And for Brian, just to follow up on Jack's question, when will you release the breakdown of city layoffs by department?
We should be able to do that relatively shortly. I want to circle back with our OHR and Chief Administrative Officer. Make sure we have the accurate information.
Okay. Thank you. That's all.
Yep.
Great. Thank you, Michaela. Pat Loeb of KYW, you're up next.
I have questions about the hiring of the contact tracers. How many will you be hiring? I'm not sure who's in charge of the answer.
Yeah, it's me. We don't know the answer to that. We're working with multiple models. One of them is hiring our own staff to do this. The other is working with organizations that might be able to provide contact tracing work, such as healthcare providers. The other is with volunteers. And so we'll see with that combination what we need. So I guess I just don't answer that.
Okay, but this first round of people that the city is hiring, how many will that be?
I think it's maybe 10 or 12. It's not a huge number.
Okay. And how will they be hired given the restrictions on like interviewing? Will there be Zoom calls for the hiring or?
Yes, I'm sure it'll be through distance, and these people will probably mainly work virtually. Much of their communications is going to be virtual.
Okay. And what is this initial contract for? How much money?
I don't know the answer to that. Again, this is what you saw is a mechanism for us to hire individual staff people, but there may be contracts with organizations that are separate from that.
Okay. Thank you.
Thank you, Pat. Sean Walsh of the Inquirer, you're up next.
Thanks very much. It was previously reported that Philly was one of many cities that got, I can't even say it, hydroxychloroquine from the national stockpile. What is Philadelphia doing with that if they still have it now that, there's debate about whether it's an effective treatment?
I'll be honest. I read that in the press. I did not receive any communication that said hydroxychloroquine is here. It may have been given to hospitals. And if so, I don't believe it is in general being used for treatment. But I have not, other than just hearing a report that there was going to be some delivered to Philadelphia, I've not heard anything since.
Okay, gotcha. Thanks. And Brian, on the layoffs, is there a breakdown for how many of the 400 are represented or not, and how many are full-time?
The majority of those are, before I say that, let us get back to you on the specific breakdown. We'll try to do that by department and by class.
Okay, and you were saying the majority are
I'm going to get back to you on the majority in class to make sure I don't make a mistake, Sean.
Okay, thanks very much.
Yep.
That's all I have.
Thank you, Sean. And we'll close out the first round with Martin Pratt of Philly YBN. Martin, you there?
Yes. Yes, I'm here. Can you hear me?
Yep. Go ahead.
Hello? Okay, sorry.
Go ahead.
2 questions. One question about trash pickup. Brian, do you have here in West Philly, we've had a lot of streets that have the trash hasn't picked up as of yet. Is there any word on when trash will be picked up from last week?
So you had trash that was, is it left over from Friday?
From not Friday. This is like our trash pickup is on Wednesday.
Okay, so that should have been picked up by now. I am going to ask you to send me over the addresses or the blocks, just so I can follow up on the crew. But we should not be that far behind. At most, we should have been 2 days behind.
Got it. Any word or any word from the Board of Education as to the Wi-Fi situation for children that don't have Wi-Fi in their home or internet?
My understanding was Dina responded back to you on that issue specifically and got you more detail. If you still need additional detail, we'll circle back.
Okay, that was it. Thank you.
Great. Thank you, Martin. Now the second round of questions. Let's go back to Pat Loeb of KYW.
Thanks. Just a follow-up to a couple earlier questions. One on the layoffs. Brian, how much money was saved?
I do not know. That was actually we're still calculating the final dollars.
Okay. And Dr. Farley mentioned cell phone data showing most people still are following social distancing rules. Can you go into a little more detail about that?
There is national data that I've seen from Google Analytics. And then I just got a peek earlier today, some data that some local people have. I don't have any thing I can show you right now, but we hope to pull things together to be able to show you that in the future.
Local people in government or?
Government working with academics.
Okay. And do you have a timeline on releasing that?
I don't. I just got a peek at it this morning, and I'm going to be learning more about it later today.
Thank you.
Thank you, Pat. Let's go to Jack Tomzik of Metro.
Yeah, this question is for Dr. Farley. For the contact tracers, is it envisioned that they will work from home?
Probably it'd be a combination that some will work from the office and some will work from home. The more managerial types will be more likely to be in the office, and the people doing the work will probably do more from home.
My second question was for the mayor. I wanted to get your reaction on seeing some of the pictures from Ocean City and other shore towns, knowing that, some of those people, at least some of them are Philadelphia residents.
Well, it's frightening. Considering what we know about the transmission of this virus, that kind of proximity is dangerous for those involved and for those they come in contact with after. Again, Brian was pretty clear that just don't be a jerk. People, I was watching Band of Brothers last night. I'm obviously watching all kinds of television. There's really nothing on network anymore, and there's no sports. And I was thinking to myself about the sacrifice that the generation of that time made in order to save our country. I really don't see that same kind of perseverance and same kind of approach in the generations of today. It's sad to see. And we should all watch Band of Brothers and remember what it was like to have to really sacrifice things, including your life on foreign soil. So it's frightening to see that all going on.
Thank you.
Jack, are you good?
Yes.
All right, very good. Let's go back to Jeff Cole of Fox 29.
Yeah, I had a few more for Commissioner Outlaw, if I could. Commissioner, I think the last time we were able to speak with you via Zoom, you said that on the issue of violence in the city, you said that you hope to get a handle on the rising homicide rate, on the homicide numbers, I think, before the weather gets warm. I think we stand now at 140 homicides, up 15% from 2019. Do you believe you've gotten a handle on the homicide rate in the city of Philadelphia? Where are you on that?
Yeah, so it's a lot bigger. Our violence reduction plan is actually far more comprehensive than just focusing on enforcement. And I actually would like to circle back to your last question. I got cut off. If you asked me if I thought I was doing a good job, the answer is yes, considering that I've been here for a little over 90 calendar days in the middle of a pandemic and all the other things that come along with it. The reduction plan, again, doesn't solely focus on enforcement, but I very quickly learned that there has to be strong emphasis on partnership and collaboration, getting the right people in the right seats. I still need to revamp my organizational structure, fill very key vacancies in leadership positions, focus on span of control, because right now I think it's a little bit too large as it relates to our operations. And, we fall under the roadmap for Safer Communities framework. But when you look at the tactical piece or the operational piece, which is operational pinpoint, we're also seeing that there is an increase in our pinpoint areas, not just in shootings and homicides citywide, but we're seeing an increase in our pinpoint area. And after delving further, we found out that we kind of let our foot off the gas in December of 2019. So there's a few things that need to happen as far as getting us out of our silos, ensuring that there's more partnership with our local, especially where we see overlap with PHA properties, our universities, SEPTA, so on and so forth, but also ensuring that we increase our pinpoint areas to the numbers that we saw back in 2008 when we knew that the plan was impactful. So the answer is yes. I think we have an idea of what we need to do. We've already begun that. And I'm looking forward to making sure that there's accountability to ensure that what we're putting in place is going to work.
Let me just follow up. You said you think you are doing a good job. What do you think you've done well?
Again, and like I said, in the 3 months that I've been here, hitting up, making site visits, and really having an opportunity to hear from folks. I mean, everything that I just shared with you is because I've had to do deep delves and find out what's what, right? I need to know what we have, what's working, what doesn't, what needs to be tweaked. Speaking to internal stakeholders, speaking with community leaders, all of that takes time. And making rounds generally, especially in a new place, I would tell you in my last position, I was hoarse for 9 months because I was out and about and speaking and engaging. And right now, we just have to adapt to this new way of being. We don't know when there's going to be an end. But like I said, being able to ID who's who, getting, again, right people like seats, decisions, and really strengthening the framework that was already in place and identifying what needs to go. Very, very important. But if nothing else, I've been able to bring people to the table that otherwise would not have been prior to my arrival.
Last question, if I could, just one more. Do you think that the beat cops on the street facing the pandemic in a city that's unfortunately been hit hard have seen enough of you? Have beat cops seen enough of you considering what it is they're facing?
Yeah, I think, again, I've already told you that there's ways for them to see more. And obviously, we're going to have to use technology to do that because I am making my rounds. I'm actually, when I'm not in the office, like I said, I'm encouraging people to stagger our time here on the floor. So when I'm not in the office, I'm out in the field. I'm pulling up on people's calls. I'm hitting the district offices just to get an idea of how things are going for them. But given that we have thousands of people who work here, there's always going to be somebody that says, well, I haven't seen her. I haven't heard from her, regardless of how many emails I push out, how many videos I make. So again, there's always room for improvement, but it's going to take some time. I've been here for, like I said, 90 calendar days. You're not going to see, and I'm new to everybody. I have not had the opportunity to come up through the ranks here. So I'm not in every face that people are already used to seeing. So it's going to take some time, as does change of culture and change of systems.
We look forward to seeing you again soon.
Good.
Very good.
All right. Thank you, Jeff. Now we go back to Martin Pratt of Philly YBN.
This question is for Dr. Farley. Dr. Farley, has hydroxychloroquine been, the usage of it been stopped in Philadelphia as directed by the FDA? And has remdesivir, I believe is how you pronounce it, has that been instituted as the drug of primary choice?
The decisions about how to treat an individual patient are made by the doctors at the bedside. They're not made by us. I'm guessing that given the information available, that the vast majority of patients in the city are not being treated with hydroxychloroquine, but I don't know enough about it to know that there might not be some that might benefit from it in the eyes of the doctor there. So I don't know. That's as much I know on that. I can say that remdesivir, we haven't seen the formal studies on that, but the information we have received from the FDA is that the study showed a real benefit of that drug. And so we want to make it more available. There are a limited number of doses that are being distributed across the country. Not as many doses as there are patients who need it, but that we are receiving those doses. There are patients in the city receiving that to the extent that we can get access to it.
Thank you. That was it.
Great. Thank you, Martin. And seeing no further questions at this point, that concludes today's daily briefing. We will resume tomorrow at 1 p.m.